Hello, I am Tanu Jaswal, UIN 227. I am from Sri Satya Sai Medical College, Phase 1 MBBS, Batch 2023. So, my seminar topic is MSUD versus homocystinuria. So, let's get started. We'll discuss on the topic about definition, causes, inheritance, symptoms, diagnosis, and treatment. Maple syrup urine disease (MSUD) and homocystinuria are both rare inherited metabolic disorders, but they differ in their causes, symptoms, and treatment. Here is a comparison. Homocystinuria. This is a flowchart. If you go series wise, like from MET, it forms HCY. From that, it forms CBS enzyme, which gives cystine. But if the CBS enzyme is removed and MET plus HCY build up, then it causes health problem. This is homocystinuria. Then we have MSUD, maple syrup urine disease. And this also, if BCKAD enzyme forms, like if BCKAD enzyme is there, then it forms a normal normal people. It gives energy and growth. But if the BCKAD enzyme is not there, then it causes health problem, and then you get this disease, that is maple syrup urine disease. Then we have the definition. We'll compare both of them simultaneously. Okay. MSUD, maple syrup urine disease, is a rare but serious inherited condition. It means the body cannot process certain amino acids, causing a harmful buildup of substance in the blood and urine. Then we have homocystinuria. It is also an inherited disorder in which the body is unable to process certain building blocks of protein properly. Then we have the causes. MSUD causes. MSUD is caused by a deficiency in the branched chain alpha keto acid dehydrogenase complex, which leads to an inability to break down the branched chain amino acids leucine, isoleucine, and valine. Homocystinuria. Homocystinuria is most commonly caused by a deficiency in the enzyme cystathione beta synthase, that is CBS, which we saw in the flowchart, leading to the accumulation of homocysteine and methionine in the blood and urine. Then we have inheritance. Both are autosomal recessive, okay. And here I have put some pictures in which you can see the normal urine and the maple syrup urine, which smells like a maple syrup. And in homocystinuria, you can see a panel A and panel B photo of a homocystinuria child. Then we have the symptoms. MSUD. MSUD has sweet smelling urine similar to maple syrup, poor feeding, lethargy, developmental delay, seizures. If untreated, it can lead to severe brain damage and then death. Homocystinuria. This has symptoms: dislocated lens, ectopia lentis, skeletal abnormalities, long limbs, tall stature, which you saw in the previous photo, developmental delay and intellectual disability, increased risk of blood clots, thrombosis, seizures, and vascular complications. Then we have diagnosis. Diagnosis. MSUD. Elevated levels of branched chain amino acids in blood and urine. Newborn screening programs often test for MSUD. Genetic testing can identify MSUD mutations in the BCKDHA, BCKDHB, or DBT genes. This enzyme's name. Homocystinuria. Elevated levels of homocysteine and methionine in blood and urine. Newborn screening for homocystinuria is available in some regions. Genetic testing can identify mutations in the CBS gene. Then we have the treatment. MSUD. Dietary restrictions of branched chain amino acid, special medical formulas and food, frequent blood tests to monitor amino acid levels. In severe cases, liver transplantation can also be considered for treatment of MSUD. Then we have homocystinuria. A diet low in methionine and protein, vitamin B6, pyridoxine, supplementation for responsive forms. Betaine to help lower homocysteine levels, folate and vitamin B12 supplementation, regular monitoring of blood, in some cases anticoagulant therapy to prevent blood clots. Now we have the biochemical test. MSUD Rothras test, in which ketone body can be found, as you can see in this picture I have put up. Then we have homocystinuria, in that you have cyanide nitroprusside test, which photo I have also put up. Thank you. Now we will do the summary. MSUD is characterized by a deficiency in breaking down branched chain amino acids and has distinct sweet smelling urine as a symptom, while homocystinuria is due to a deficiency in cystathione beta synthase, that is CBS, leading to elevated homocysteine and methionine with symptoms like lens dislocation and increased clotting risk. Both conditions are inherited in an autosomal recessive manner and can be diagnosed through newborn screening and genetic testing. Treatment focus on dietary management and supplements to control the level of problematic metabolites. Thank you. This will be all on my seminar topic MSUD versus homocystinuria.